Recognizing shock. Objectives: know the definition of shock. Recognize the signs and symptoms of shock. Recognize that there are different types of shock. Discuss interventions/treatment of shock. Understand the differences in neonates. What is shock? Shock is a clinical state in which the delivery of oxygen and substrates is insufficient to meet the demands of the body. What is shock? Death. What are the results of shock? Tissue hypoxia/cellular dysfunction. Metabolic acidosis. Organ dysfunction/failure. Death. What is shock? For each hour that shock persists without treatment, the mortality rate goes! What is shock? In most cases of shock, the patient's cardiac output is insufficient to adequately perfuse the body's organs. What is shock? Goals in treating shock: restore intravascular volume. Treat any myocardial dysfunction. Treat vascular insufficiency. In order to HR and BP. Improve perfusion. Metabolic acidosis. Urine output. Signs and symptoms of shock. Assessment parameters. General appearance. Capillary refill. Pulses. Vital signs. Urine output. Questions to ask: signs and symptoms of shock. General appearance. What does the patient look like? Evaluate mental status. Signs and symptoms of shock. Capillary refill. Evaluate skin perfusion by checking capillary refill and skin color. Capillary refill is evaluated by positioning the extremity just above the heart level, pressing a finger on the palm of the hand or the bottom of the foot, letting go and then counting how long it takes the color to return to the extremity. Interpret capillary refill in conjunction with other signs of shock, as it is a poor indicator when used alone. Signs and symptoms of shock. Signs and symptoms of shock. Is this a sign of poor perfusion? Signs and symptoms of shock. Yes. Signs and symptoms of shock. Pulses. Evaluate pulses. Signs and symptoms of shock. How do you compare pulses? Palpate peripheral and central pulses and compare femoral and pedal, or brachial and radial. Are they weak/thready, normal, bounding, absent? Note: a patient will lose peripheral pulses before they lose central pulses. Signs and symptoms of shock. Vital signs. Evaluate vital signs. They are called vital signs because they are really, really important. Signs and symptoms of shock. They are really, really important. Signs and symptoms of shock. In order for vital signs to be helpful, you need to know absolute number, context or clinical scenario, trends. Signs and symptoms of shock. Absolute number. Is the number normal or abnormal? Signs and symptoms of shock. Context. What is the child doing? i.e., sleeping, playing, etc. What is the clinical condition the child is in? i.e., dehydration, fever, anemia, hypoxia, pain, anxiety, etc. Signs and symptoms of shock. Trends. Are the vital signs improving, stable, deteriorating? Signs and symptoms of shock. Stable means unchanging or static. It does not automatically mean normal or good. Remember, death is a stable state. Signs and symptoms of shock. Heart rate. You must evaluate the heart rate in the context and clinical state of the child. Is he running around? Is he febrile? Is he crying? Signs and symptoms of shock. Heart rate. Rate normally decreases as child's age increases. Tachycardia is the body's response to stress. Note normal ranges on vital sign reference sheet, see next slide. Pediatric vital signs reference chart. Age. Weight. kg. Pulse. Respiratory rate. Systolic. BP. Diastolic. Birth. 2.7 to 4. 100 to 180. 35. 50 to 70. 16 to 36. 1 month. 4. 100 to 220. 30. 60 to 90. 20 to 60. 6 months. 7. 80 to 150. 87 to 105. 53 to 66. 2 years. 12 to 14. 25. 95 to 105. 4 years. 16 to 18. 70-110. 23. 6 years. 20 to 26. 70 to 110. 21. 7 years. 97 to 112. 57 to 71. 8 years. 20. 10 years. 32 to 42. 55 to 90. 19. Adolescent. Greater than 50. 55 to 90. 115 to 128. 66 to 80. Normal values. Systolic BP 1 to 7 years, age in years plus 90. 8 to 18 years, 2x age in years plus 83. Diastolic BP 1 to 5 years, 56. 6 to 8 years, age in years plus 52, signs and symptoms of shock. Heart rate. CO equals HRXSV. CO equals cardiac output, volume of blood ejected by the heart each minute. HR equals heart rate. SV equals stroke volume, volume of blood ejected per beat. The body attempts to compensate for a decreasing stroke volume by increasing the heart rate. Signs and symptoms of shock. Blood pressure. Measure systolic BP and diastolic BP. Calculate pulse pressure, SBP, DBP equals pulse pressure. Why? It is important to identify a widened pulse pressure because it may be an early sign of shock. If you wait to respond, it may result in a decrease in BP and narrow pulse pressure. Documenting unable to obtain when measuring BP is unacceptable. Hemodynamic response to shock. 140. 100. 60. 20. Vascular resistance. BP equals COX VR. As the CO the HR and VR. This enables the body to maintain a normal BP. This is a key difference between children and adults. Percent of control. Slide 11, Hemodynamic response to shock in infants and children. This figure illustrates typical changes in heart rate, blood pressure, and cardiac output as the child moves from compensated to decompensated, hypovolemic to hypotensive, shock. Note that tachycardia without hypotension is present in compensated shock. Blood pressure is initially maintained through an increase in systemic vascular resistance. As cardiac output falls further, blood pressure begins to fall, and shock is characterized as decompensated shock. Cardiac output. blood pressure, decompensated, or late shock, compensated, or early shock. Signs and symptoms of shock. Blood pressure. Hypotension typically develops before loss of central pulses. Hypotension is an ominous sign. If it is not treated promptly, it will lead to cardiopulmonary failure/arrest. Signs and symptoms of shock. Urine output. Evaluate urine output. Urine output is a good indicator of renal perfusion, but do not use the initial measurement of urine. Signs and symptoms of shock. How to calculate normal urine output. Signs and symptoms of shock. Assessment questions. Does my patient have normal perfusion? What is the capillary refill? How do the central and peripheral pulses compare? What is the HR and BP? Is the patient improving? What is my patient's mental status? Is my patient urinating? Is it adequate? Types of shock: hypovolemic shock, cardiogenic shock, neurogenic shock. Inadequate intravascular volume, most common. Cardiogenic shock. Characterized by myocardial dysfunction. Neurogenic shock. Characterized by nervous system dysfunction. Anaphylactic shock. Life-threatening exposure to an allergen. Types of shock. Septic shock has three components. Systemic inflammatory response. Infection. Poor perfusion and hypotension. Types of shock: systemic inflammatory response syndrome. Greater than 2 of the following. Abnormal temperature. Tachycardia. Tachypnea or respiratory alkalosis. Abnormalities of WBC. Types of shock. Physiologic classification of shock: early, late. Signs of inadequate tissue/organ perfusion. Normal BP. Late. Signs of inadequate tissue and/or organ perfusion. Hypotension. Types of shock: irreversible shock. Complete failure of the body's compensatory mechanisms. Death occurs even in the presence of resuscitation measures. Types of shock: early shock. What will the body do to try and compensate? Types of shock: have a catecholamine surge which results in tachycardia. Systemic vascular resistance. Cool, pale, mottled skin. Capillary refill greater than 2 seconds. Weak, thready peripheral pulses. Types of shock. What else? Blood pressure changes. Increased respiratory rate. Patient may be irritable, sleepy, lethargic. May see a decrease in urine output. Blood pressure changes. Systolic is normal or even high. Diastolic may be low. Types of shock: late/decompensated shock. Defense mechanisms begin to fail. The patient may exhibit hypotension, prolonged capillary refill, tachycardia or bradycardia, ominous sign, absent peripheral pulses, rapid, thready central pulses, decreased level of consciousness. Interventions/treatments. Provide O2 and mechanical ventilation. Fluid resuscitation. 20 ml/kg NS boluses, note the plural. Vasoactive infusions, dopamine. Treat metabolic abnormalities. Interventions/treatments. Clinical strategies. Know your patient's history. Know normal versus abnormal and look for abnormalities. Know your patient's vital sign trends. Think the worst-case scenario and then rule it out. Interventions/treatments. Clinical pearls. Know and look for these early warning signs. HR, the most commonly ignored abnormal vital sign is tachycardia. Peripheral perfusion abnormalities. DBP, look for diastolic hypotension and look at the pulse pressure. Interventions/treatments. You must do frequent, rapid reassessments of the patient's hemodynamic status and document everything. Neonates. If children are different from adults, then neonates are something else entirely. Neonates. Differences in the neonate. We are talking about patients with an age of less than 28 days. Limited cardiac reserve. Limited respiratory reserve. Limited metabolic reserve. Neonates. Take-home message for neonates. Neonates can go into a shock state faster than children and adults. Neonates have less tolerance for shock states than children and adults. You must identify and treat shock immediately. Message from Dr. Ernan: recognize shock and label it. Rapidly and repeatedly assess hemodynamics. Mortality is related to persistent shock. Be appropriately aggressive with fluids and vasoactive infusions. Intubate and mechanically ventilate early. Remember the neonate. Jumpstart the circulation or patients die. Shock reference chart. Early. Late. Respiratory rate. Increased. Bradypnea, ominous. Heart rate. Bradycardia, ominous. Pulse quality. Decreased to thready. Bounding in septic. Peripheral pulse may be absent, central decreased. Capillary refill. Prolonged more than 2 seconds. Prolonged. Lock. Normal to altered. Altered mental status. BP. Normal. Hypotensive. Urine output. Decreased. Anuric.